Welcome back me channel. Today we discuss about benefits of inpatient rehab. Let's start. The benefits of inpatient rehab. An inpatient rehabilitation facility can provide those in recovery a safe environment to detox, a higher success rate, and a supportive community. For those fighting a severe addiction, inpatient rehab may be the best option. What is inpatient rehab? Inpatient rehabilitation facilities are centers for someone seeking help for a drug or alcohol problem where they live full-time. This is in comparison to outpatient rehab when someone attends treatment during the day but goes home at night. Inpatient rehab, also called residential treatment, is appropriate for severe addictions and offers care 24 hours a day. This is typically a non-hospital setting and provides a community of support for those recovering from substance abuse. The average stay of residential treatment is 30 days, but some treatment programs offer longer lengths of stay between 60 to 90 days, depending on the severity of an individual's addiction. They might attend long-term residential treatment or short-term residential treatment. While it is not appropriate for everyone, there are many benefits of inpatient rehab. What is the benefit of inpatient? Studies have shown that more inpatients complete detox compared to people in outpatient treatment. Those who attend and remain in treatment have increased occupational, psychological, and social functioning, as well as decreased criminal activity. What are the benefits of rehabilitation? It can help to avoid costly hospitalization, reduce hospital length of stay, and prevent readmissions, as rehabilitation also enables individuals to engage in or return to work and employment, or to remain independent at home. It minimizes the need for financial or caregiver support. What is the treatment and rehabilitation approach? It is a highly structured program wherein the community is utilized as primary vehicle to foster behavioral and attitudinal change. The patient receives the information and the impetus to change. From being a part of community, role modeling and peer pressure play significant parts in the program. What is the process of rehabilitation? Rehabilitation is the process of helping an individual achieve the highest level of function, independence, and quality of life possible. Rehabilitation does not reverse or undo the damage caused by disease or trauma, but rather helps restore the individual to optimal health, functioning, and well-being. What are the benefits of inpatient rehab? Compared to outpatient rehab, there are many advantages, including safety and a higher success rate from the moment an individual decides to seek treatment. They are preparing to go through a drastic change in their life. While this change is for the better, it comes with its own set of challenges to face, starting with detoxification. Inpatient detoxification. For someone who has been abusing drugs or alcohol, the process of going through withdrawal and detoxing can be very unpleasant, and many try to avoid it for as long as possible. Most drugs have a unique set of withdrawal symptoms. Some drugs, like meth, have symptoms like anxiety and fatigue. Users can also experience psychosis, where they experience hallucinations and delusions. The withdrawal symptoms from opioids like oxycodone and codeine include body aches, vomiting, diarrhea, fever, high blood pressure, and shaking. Someone detoxing from alcohol may experience tremors, seizures, and delirium tremens, resulting in reduced blood flow to the brain. Trying to detox on your own is very dangerous and not recommended. Left unsupervised, withdrawal symptoms can be potentially deadly. Questions about treatment. One of the benefits of inpatient rehab is that they provide a safe place to detox where medical professions can monitor vitals and ease some often pleasant symptoms, depending on the substance and severity of the addiction. Withdrawal symptoms usually start a few hours after. The last dose of the drug, alcohol detox, generally lasts anywhere from 3 to 10 days, with withdrawal symptoms starting within 6 hours. And being their worst at 72 hours, alcohol withdrawal lessens significantly in severity after 72 hours to 1 week, which is called the acute withdrawal phase. There have been reports of symptoms lasting for a month, and sometimes feelings of anxiety and depression last for months. Post-acute withdrawal symptoms. Pause can last as long as 1 year, yet it does not have severe medical issues related to it. More common symptoms of pause include anxiety, restlessness, poor concentration, and poor sleep. Being in an inpatient rehab facility means patients have constant access to help for their withdrawal symptoms and can be provided with medications to ease their detox. Success rate. When someone attends outpatient rehab, they can go straight to the liquor store or contact their dealer when they feel like giving up. Returning home each evening places them back in the environment where they abused a substance, which makes it much more challenging to resist the temptation of relapse. One of the benefits of inpatient rehab is that patients do not have access to their substance of choice, and while they have the freedom to leave at any time, they will likely not come back if they exit rehab and relapse. Studies have shown that more inpatients complete detox compared to people in outpatient treatment. Those who attend and remain in treatment have increased occupational, psychological, and social functioning, as well as decreased criminal activity. Those who overcome a substance use disorder said learn the tools to prevent relapse and may be at a decreased risk for developing another SUD, according to a study published in JAMA, which said, as compared with those who do not recover from an SUD, people who recover have less than half the risk of developing a new SUD, contrary to clinical lore. Achieving remission does not typically lead to drug substitution, but rather is associated with a lower risk of new SUD onset. Are the benefits of inpatient rehab worth it? Because of the demand for 24/7 staff, medical care, food, and housing that is required for inpatient rehab, the cost is higher compared to outpatient rehab. Some may believe that alcohol addiction treatment is not worth the price, but in reality, an addiction costs far more than treatment. Substance abuse costs America over $600 billion each year, but treatment has been shown to reduce costs. Thanks for watching. Subscribe for more informative videos.